when you're looking at somebody, especially a woman that's having energy problems and things like that, what are the hormones they should have like checked in general?
So they should always have, a full hormone panel, which includes testosterone, estradiol, progesterone, and an FSH. You can also do an estrone level. And then I always do a full thyroid panel as well, which includes a free T3 level, TSH, free T4, free T3, and then a thyroid antibody. And you can also throw in a reverse T3, but that's getting a little bit deep. And then a vitamin D, B12, and folate. I always check all of that on a patient when they first come in, just to make sure that they're all balanced. And I haven't found one that has all those balanced yet.
Well, what's the most common thing? What is the most common thing you see?
I see a lot of hormone imbalances, whether it be estrogen dominance, low progesterone, and low T, and then thyroid imbalances as well.
Now, when you see problems with the estrogen levels and the progesterone levels, what is it that you're using to help to improve that?
So I can use DIM, to help metabolize the estrogens a little better. There's some other supplements that I use that are a combination of a bunch of things. And then I can, compound progesterone. And depending on whether they're, have low progesterone levels and high estrogen, I'll work on metabolizing the estrogen out of the body safely. And then, compounding the progesterone, and they can take that depending on if they're having a menstrual cycle or not. They can cycle that on days 14 through 28 of their cycle, which is going to mimic what their own body would do. And then if they do have low testosterone levels, I have a lot of women that are, in their 40s, some in their 30s, and they're still getting menstrual cycles, but their testosterone is really low. So I can treat them with hormone, testosterone therapy via a pellet. And that really gives them back, the life and the vibrance that they're really looking for after they've been, after they have their testosterone optimized.